Okay, so I have 5 o'clock. Do we want to have a motion to start the meeting? Beth?
I make a motion to start the meeting, sorry.
I second that motion. All in favor? Beth?
Aye.
Maggie, yes. Okay, I just want to read a little thing. Just welcome to the Board of Health meeting for August 31st, 2021. In accordance with Mass General Law, we're required to let you know that this meeting is being recorded, and anyone in the public should not be recording any portions of this meeting. If you are, please let us know. Moving on, we'll proceed first to public comment. Public comment is if anyone has anything they'd like us to hear. You have probably 5 minutes to say your public speak time. We will not respond, but we will listen and take into consideration anything that you would like us to hear, and consider it for future discussion. So with that being said, I'd like to open for public speak time if there's anyone that would like to do that. I guess maybe, yeah, raise your hand, or because everybody's muted. So Amy, Flora.
Okay, I'm not great at Zoom, so I'm trying. I'm unmuted, I think.
Yes.
Okay. I can go ahead?
Yep.
Okay, I just want to put a few things out there. I'm Amy Florick. I own Amy's Place Bar and Grill for 20 years now. I've been in town. I think that the city has been doing a great job, and I know this is difficult times for everyone, but I just wanted to put a few things out there as a business owner, that we've come pretty far and we do have choices now. I appreciate the advisories that the health board has given as well. I know there's some businesses already that require masks. I, however, feel that there are choices now, and that the public should be able to make choices and business owners should be able to make choices. The vaccine is FDA approved. You can wear a mask, and we welcome masks in Amy's Place, and it doesn't matter one way or the other. Obviously, we like everyone to be vaccinated. All my staff is vaccinated. I'm personally vaccinated. My family's vaccinated. And I just feel that putting a mandate in place is not letting individual businesses conduct the way that they should and have a say in their business. You have a choice if you want to come in, or if you're not comfortable, if people aren't masked up. I feel that as adults, you should be able to make decisions now for yourselves and either get a vaccine or, wear a mask. We're okay with wearing a mask. I just don't feel that it's necessary for our city to have to put a mandate in place. I've also seen a few people that I know that are vaccinated, that do, have been vaccinated in neighboring towns. They don't choose to go to some towns because they don't have choices. And I want everyone to be safe, but these are all people that have been vaccinated as well. And now they're not choosing to go to other restaurants in other towns because they don't get a choice on whether to wear a mask or not wear a mask. I just feel like it goes a little bit too far. There's no, state of emergency. There's no state mandate. I realize a lot of other towns are doing it. I also feel that sometimes the stats are not always about people that are unvaccinated. And basically, I would just like to be able to have my own choice of what to do inside my business that I've been running. And I run a nice, clean business. I run a fair business. Everyone's welcome, and I want everyone to feel comfortable. I just don't feel that there needs to be a mandate for masks at this time. I think that's about all I have. I won't keep running on, but thank you for listening to me.
Thank you, Amy.
Hey, Maggie, can I just add, can I mute everybody? I thought that the settings had it that way, and then I will have Maggie and Beth unmuted, but because we've been Zoom bombed so many times, I'm just a little nervous. So I'm just going to mute everyone. And then if you want to speak, either manually raise your hand or raise your hand with, I think there's emojis. Are you okay with that, Maggie?
Yes, definitely. Okay. I thought we were doing that already. Yep.
I thought so too, but I did it wrong apparently. Okay, so Maggie and Beth, you should have the ability to unmute, and then anyone else that wants to speak, I'll just unmute for you. So Chico.
Hi there, my name is Jim Bliss. I think my kids probably made Chico Rojo my name, and I'm not used to Zooming, so I don't know what to do about that. But I'm an Easthampton resident, and I listened with interest to what Amy just said, and she's in a particular position because her business requires people to specifically not be wearing masks so that they can eat and drink. And it's really just an impossibility for her to run her business with such a mandate. But I'm wondering if there could be something done about different types of businesses and the different types of restrictions that we might have on them. So for instance, maybe Amy's place doesn't follow the same restrictions that Big E's does, or a supermarket, or a coffee shop, or, you know, there could be different situations for different people. But I also heard that it doesn't really matter one way or the other. I think she mentioned what people do. And I would disagree with that. I think it really matters pretty greatly what people do. And for people to have independence is really nice, but we also find ourselves to be in pretty extraordinary times. And if you do look at the dashboard, we now have 43 active cases in our town. And there were 6 on July 30th when the CDC updated their guidance. And so things are really kind of going in the wrong direction. And to allow people to make their own decisions, I think you could argue is not working considering the place that we're in. And while Amy might be right that we're not in a disaster zone right now, and that the state hasn't updated its guidance, we don't really want to become a disaster zone. And I think that we're at a really crucial time right now where we have a variant. We don't know exactly what's going to happen with that, but we know that it's getting worse. And we know that if we do nothing, it's going to get worse beyond what it would be if we had masks. And in particular, and this is the really serious thing, we're sending our unvaccinated children back to school right now. And a lot of people are really freaked out about that. And I think it would be terrific to come together as a community to do something, to do as much as we possibly could in order to keep people safe at this particular time. We might find that we don't need to have a mask mandate in a month from now. But I think it would be really wise to put something in place, especially for the places that really have no business complaining about a mask mandate. Amy's place, that might be a different scenario. But River Valley Co-op, why not have a mask mandate there? There's no need for anybody to be walking around unmasked in a place like that. And indeed, I see a lot of families going shopping with children who are too young to be vaccinated, without masks, parents and children, lingering in stores, lingering in places. They don't really care. They don't think of it as a real issue, which is why I think we need some leadership from the health department to really tell people that they need to be paying attention to this. So maybe we treat different people in different situations differently, but it's really something that we have to look at very strongly, considering the timing of going back to school and the way that the cases are. You know, 43 cases in our town. It's here. COVID is in our town. It's here. So thank you.
Thank you, Chico Jim.
Lindsay.
Hi all, Lindsay Mailer. Many of you know me, but tonight I'm speaking as a resident. I wanted to offer insight that maybe it's not even insightful. But this week I am working between my office and remote because my daughter's daycare in another town is closed for the week due to a rampant COVID outbreak of 6+ cases that they know of in the facility. So it's pretty real for me and my 3 children. I have a 16-year-old who's vaccinated, but I have a 16-month-old and an 11-year-old who can't be vaccinated yet. But one thing I want the board to consider are these 2 factors. So it doesn't sway either way. I'm pro-vaccine, I'm pro-mask. But I have a child with respiratory issues who is in sports. So I know that sports is kind of a wavy line, and Maya already put out their advisories that no masks are required for outdoors, but they're considering it for indoors. And it's a lot to take into consideration when you have different children playing sports, but to take into consideration that there are kids who can't wear masks. And so if masks are mandated for his sports, I have to pull him from sports. And then in the same breath, I guess I want the board to also consider if we put in a mask mandate, it could possibly risk making the vaccine numbers not as high as we want to see them, because we have a lot of people out there who are already frustrated by mandates. And I'm worried that if we put in a mask mandate, we'll see people say, well, if I have to wear a mask either way, then I won't get vaccinated. And that worries me. So I know the board and I know Bree, you guys all have your work cut out for you, and it's not an easy decision either way you go. I support whatever decisions you guys make. I'll help enforce them. I'll be there 110% along the way. But I worry about people getting vaccinated if we have a mask mandate in place. And then I worry about kids in sports who can't play if they have a mask covering as well. And I'm so for it for River Valley Market and grocery stores, municipal buildings. Yes, we should be masking in those places. But again, I think I wave on the side of caution with Amy that there might be certain places, like 21+ places, like Amy's, maybe you don't need a mask in there if you show proof of vaccination. I don't know. I don't know which way you guys need to go, but I wanted to offer those 2 bits of insight on my end. Thank you.
Lindsay.
Jen, I'll unmute you, and if you don't mind just stating your last name so our admin can record it.
Absolutely. My name's Jen Stauffer, and I live in town. I have kids who are too young to be vaccinated, and also I'm an owner of a business in town, the feed store, Easthampton Feed. So I'm here to just speak in favor of a mandate. I think, for all the reasons everybody's stating and the reasons that we have an advisory, that, as cases are rising and we're hoping people wear masks, I guess we see a lot of people like the CDC is asking us to wear masks also. And I'm speaking about indoor spaces, like not outside while kids are playing sports or things, but in indoor spaces. What we're doing at our business is we've asked, anybody who's not vaccinated is supposed to wear a mask. Our staff are wearing masks. And we have the town's advisory posted, but a lot of people don't wear masks indoors. And it just feels exhausting to argue with people all the time about it. So we just are going with the town stance is our stance in the business instead of adding another layer on top of it. I guess that's a little bit of us like passing the buck instead of making our own rules, but it's just really a lot to argue with people all the time. So if we can say that there's a mandate, that feels great. That's easy to be able, there's a mandate. That's why we don't want to argue with you anymore. That's just the rules. That's what we're doing. And I feel like if there's enough cause to have an advisory, then we might as well just have a mandate, because an advisory is out there and a lot of people aren't following it. So I'm hopeful to see it turn into a mandate. So, and I recognize this is a lot and you get a lot of input from a lot of different directions. So just thank you so much for the work you guys are doing.
Thanks, Jen. Is there anyone else that would like to have any comment during public speak time? Okay, so a motion to move on to the first item on the agenda, the mask mandate.
I second that.
All in favor? Maggie, yes.
Yes.
Okay, so here we go. It's just you and I, Beth. So Reed, is there anything you want to add or say or go over before we?
Yeah, so I have some comment from Amy Hart, our previous public health nurse. Her last day was Friday, but she did offer some comment. And I also have a letter from the mayor. And then I also wanted to show some data for Easthampton specifically after that. And then I'll share my screen and show the mask order, and we can kind of get into some of the details that we need to kind of work out. So I will start with the mayor, who wrote a memo to the Board of Health. She said, I am submitting this memorandum for the Board of Health's August 31st meeting as I have a prior commitment. Thank you all for your leadership through and service throughout the pandemic. Easthampton is very fortunate to have this board and our health director to lead efforts to mitigate the impact of COVID-19. Our last two data dashboards were concerning, comparing the % of those vaccinated in our transmission rate. I ask you to consider further interventions, including a mask mandate for indoors, both public and private buildings, large gatherings, in-city vehicles, community education, and if indicated, explore public testing, if even the home tests, and the closure of public buildings. Public health must come first, realizing the serious impact any of the above actions is sure to have on our business community, regardless of size, as well as public art events. And the comment from Amy, she said, why I support a mask mandate for Easthampton at this time. Local cases have consistently risen over the past 5 weeks, both in Easthampton and in surrounding counties. The entire country is currently categorized by the CDC as high transmission. The Delta variant is now estimated as causing 98.6% of new infections in the Northeast region. The main characteristic of this variant is that it is more than twice as infectious as previous versions of the virus. The city's vaccination rate has not yet reached a minimum threshold of 80%, and it is believed that an even higher percentage of vaccination coverage may be needed to contain the spread of this particular variant. While vaccinated individuals are more protected against infection after exposure to Delta compared to individuals who have not yet been vaccinated, anyone infected with the virus is similarly contagious during the first 6 days of their illness, regardless of whether they are vaccinated or not. We continue to see a significant proportion of newly infected people who do not experience any symptoms or have only minor symptoms similar to allergies, which means that many people do not get tested for COVID-19 or stay home from work and other public places while contagious. Communal mitigation strategies used during earlier phases of the pandemic are no longer in effect. Enforcement of social distancing, moving public activities outdoors, allowing employees to work from home, additional paid leave to support quarantine after known or ongoing household exposure, etc. Not having communal mitigation policies and practices in place on a broad scale makes indoor public masking an even more crucial method of reducing the spread of this airborne virus. Indoor public masking has been shown to significantly reduce the spread of COVID-19 by limiting the amount of virus an infected individual may expel through their nose and mouth and share with the people immediately around them, as well as the volume of aerosolized particles that can build up in an indoor space. Masking has also been shown to reduce illness severity in those who do become infected by limiting the amount of virus that may enter their body. So that is from Amy, and I'm going to share my screen if you don't mind, Maggie, and just show some data and then pull up the order as well. Okay, so I'm gonna first start with, I wanted to just show some data just so you guys could see it up on the screen. These are our weekly cases from June 1st until August 30th. So obviously a pretty significant increase. In June, we were really low, 0 cases, 1 cases. And then we started to increase towards the end of July. And right now, 25 cases from the 24th. Sorry, what?
I was just going to say, are you wanting to show the graph or the numbers? Because all I see is the mandate.
Oh, really?
Yeah.
Oh, hold on. I must have hit something. I did something wrong.
Sorry, didn't mean to interrupt, but.
No, it's fine. Let me try again. Oh, you know why? I was on the wrong screen. I toggle between my remote desktop and my home desktop. So do you see it now, the graph?
Yep.
Okay.
Yep.
So these are weekly cases from June to August with an obvious increase. These were confirmed cases from Maven. And then let me get to the next one. This is also an important one to see, the 14-day daily average per 100,000. Again, we are at 0.4 for a very steady period, and we're all the way up to 17.5. So that's 17.5 daily cases averaging over 100,000 people. So that's definitely, we're seeing increases. So there's really no question on that. As for the mask order, I'll kind of do an overview of it. I know we have a few questions that at least I want to iron out.
Yep.
But like Amy said in her write-up, 98% of our cases are Delta variant. It's known to be twice as contagious as previous variants. So we're kind of dealing with a different beast than what we were dealing with last, summer, I guess, in 2020 when we were dealing with just the original variant. I think I just have to mute her. So as for the order, we have the authority to do this under Mass General Law, Chapter 111 and Section 31. Overall, this order is going to require masks in public indoor spaces, so stores, municipal buildings, office spaces, anywhere that the public is generally invited into. There's this part here: food service establishment employees shall wear a mask both indoors and outdoors while serving customers. So this is a similar order to Northampton, but I did want to just note some differences. For outdoor public events, I put a number on it. I did 100.
Yep.
Because I think there will be confusion from event coordinators of what's considered a crowded outdoor public event. So just to make it easier, I put 100 on it. Of course, it can be edited. Some of the things I'm thinking about are like the Arcadia Folk Festival, Food Truck Friday, Mill Pond Live, and all of those event coordinators have come to me and kind of asked me for guidance. So I think this will be helpful for us to just have something on paper for us to go off of. It does say where physical distancing cannot be maintained. So that's important because that was brought up. The city has the spot lot that has 6 foot spacing between all the little polka dots. And she asked, if they're outdoors and they're specifically 6 feet away, would they need masks? So they wouldn't under this order.
And is that clear to everyone what you mean by physical distancing? Like, are they going to understand that means the 6 feet?
I can change the language to just say where physical distancing of 6 feet or more is maintained. So
I think we need to be specific on that, please.
I agree with that.
Okay. There's a few different versions of this, and I think our previous one had that. I think it must have just gotten taken out, so I will add that. Originally, Northampton did have masks in their draft to be required for high-risk sports, which would be football, competitive cheerleading, it's listed up on here, basketball, ice hockey, outdoors. And they ended up changing that to where there would be kind of communal seating or communal gathering, so benches, dugouts, and common seating areas for both moderate and high-risk contact team sports for outdoors. And just to note, indoor sports are covered under the MIAA order, so we don't have to worry about that when it comes to sports. But again, I wanted to just throw that out there that's the high-risk and moderate sports are defined in here, and you can figure out if you guys want to discuss afterwards, if you want them while they're playing or similar to Northampton's order, which is on the sidelines. Exemptions. So nothing in this, we put in here, nothing in this order is intended for residents to enforce it on their own. Residents can lodge complaints with the health department and we will enforce them to the best of our ability. Children under 2 are not required to wear a mask. Employees in shared office spaces that can maintain 6 feet of distancing may take them off. I know East Long Meadow took that out and they just require them in general in shared office spaces. Northampton kept it as 6 feet or more. So that's one of the things that we can discuss. performances. So performers can take them off if they are able to maintain 10 feet from any member of the public. And face coverings are not required while swimming, which that actually was a question that has come up. Sorry. The Mass General Law gives us the authority to enforce up to $1,000 per day. As you guys know, our enforcement style is not to do that, but we have that as an,
Sorry.
it's okay. We have that as an option if needed, but normally what we do is we first start with education, written warning.
I'm so sorry. I don't know how to shut it off.
You use the silence button on the side, like the vibrate silence button, or but and so normally we start with education, written warning, and then unfortunately it's rare, but we have the ability to fine $1,000 per day. I'm just asking that it goes into effect on Thursday if you guys do vote it in, just so I have time to get it out to the public and do all my postings on the website and such. So I don't know if there's anything you guys want to edit. I did want to add 2 more things. The mayor requested that we add in language about them while in city vehicles, which I think that's just missing from our order. I think that's a good idea. And then I did want to clarify for restaurants that the masks can be taken off. We could put it in the exemptions that the masks can be taken off while seated and eating, just so there's no confusion on that.
What about in bars? Is that the same language?
That's a good point. For majority of the pandemic, as Maggie and I know, bars weren't really allowed to be open. So we don't have a lot of this order is based off of the language from our old sector specific standards that we used to follow. Bars are difficult because one of our concerns is kind of the congregating, the standing, and the good thing about restaurants is people are seated and they're kind of in one spot and eating with, you know, just whoever they're with. I mean, we could put language in there that in bars, that the masks need to stay on unless seated and drinking, like actively drinking. The most recent sector specific standards from the state, like right before the pandemic, right before they kind of rescinded everything, was the masks had to stay on at all times unless literally eating or drinking. So it first came out that you could take them off while you get to your table and you sit. They later changed it that you had to put it back on, you know, in between, like maybe our appetizer and main course or in between drinking. So we can change the language however you guys see fit. I would recommend just requiring masks unless seated and drinking and eating. We can put that language in. Oh, sorry.
Yeah, I think we, you know, and I agree with that. I mean, bars are tough. We want them to be able to stay open, but we can tweak the language a little bit. I mean, Beth, what are your thoughts?
Yeah, I was just thinking or not necessarily a distinction, but there should be some clarification, only because I can just imagine like people, you know, a crowded bar, everyone with a beer in their hand and nobody in a mask. It's sort of a perfect super spreader situation. So some kind of guidance there, I think would be if we're passing a mask mandate, we might as well, you know, make sure we clarify that.
Would you want to say masks? Do you think it would cover it by saying masks would be required unless seated and eating and drinking? So I'm just picturing, we actually don't have a lot of bars in town that don't offer food, but I'm just picturing the bars that don't offer food, just everyone standing up and kind of talking. So as long as they have their mask on while they're standing and talking, but then if they want to sit, you know.
I agree. I think, and you know, they can do the outside seating. Some of them have that capacity. I think if they are standing, you know, they're going to have to leave their mask on. They're obviously not going to be able to drink until they're seated. So, you know, the bar will have to accommodate with more seating. That would be the only, you know what I'm saying?
So do you want me to add in there, masks can only be taken off if seated?
Yes.
For eating and drinking.
While seated though.
Right. While seated
and eating and drinking. Okay.
Right.
So I'll add that language in and send it to you guys.
Yep.
I'll add city vehicles
Okay.
and the physical distancing of 6 feet or more.
Yep.
Yeah. And I was going to say, like, in terms of enclosed office spaces, like where I work at Cooley, that's the current policy. I think it's supported. You know, if you're 6 feet away from someone and you're vaccinated and you want to take your mask off, it's okay. Like in office spaces.
Yeah. Is there, what's the current thinking about like the plexiglass dividers and things like that in office spaces?
I know the city has and most departments that can accommodate the plexiglass have it up. So I know that municipal buildings are pretty covered.
But I mean, do we, I'm just putting it out there just to kind of cover all bases. Like, are we going to still require if the business has plexiglass dividers, will they still need to wear a mask?
Yeah, I
think so too.
Yeah, most of the language that I've seen around these types of orders, that hasn't been an exemption.
Okay.
Yeah, I've you know, to me, it's sort of like the CDC's guidance on face shields. Like they're not considered enough.
It's a good point.
It's the same idea. Plexiglass is a good barrier, but it's limited.
Okay. All right. Anything else, Bree, before we talk about sports? Or no, not sports. Yeah, sports.
No, I just wanted to add in the seated while eating and drinking. And are you okay with, one other thing I wanted to mention was, I did speak with Northampton when they edited their order. They took out the threshold. They think it was 3 cases per day per 100,000 for them to lift the mask mandate. I noticed today in their amendment, they took that out. They didn't feel comfortable kind of setting a specific number without kind of being able to tell the future. But on our state call today, the attorney for the Mass Health Officers Association did just recommend that boards of health review this monthly at their Board of Health meeting. And if we don't have a Board of Health meeting, then to review it monthly regardless. So the state is also going to send us template signage. Normally I make signage for restaurants, but there was some concerns about there being some discrimination because the signs typically don't say unless you have a medical exemption or unless you're 2 years young or younger. So they're going to send us those templates. I hope I have them by tomorrow so I can send them out if this gets voted into our restaurants, but just that heads up. And at this point, this is unfortunately where we're at. It doesn't seem like the state is going to release anything. They really are relying on us at the local level to do this, I think.
Okay. Are we required to put something in here about monthly review?
I can put some language under the effective date that says this order will be reviewed monthly. And, you know, just, it is helpful for the public to see a light at the end of the tunnel. And I want to have that too. But, you know, with this new variant, things are just different. And I don't think that, I mean, it's up to you guys if you want to put, you know, I wouldn't want to say like once 80% of the community
I don't want to put a detailed specific on it. I think looking at statistics and current state,
And we do have an epidemiologist doing our dashboards moving forward. So she is obviously
Proactive.
an expert at this point. So we'll definitely be able to rely on her. So, but if you want to talk sports.
I agree with leaving it open, reviewing monthly, because it's a lot easier to lift a mandate than to put one,
Right.
So if we
Exactly.
pull it too fast, then
Right.
so.
Then we might be back at it 2 weeks.
Right. Which might happen anyway, but hopefully not.
All right. So I guess is to address some of the public comments, children's sports who have medical illness. Is there have you seen anything about that in other mandates or CDC recommendations?
So we have a general exemption that anybody who has, so under this.
Yeah. The disability, number 5.
Anyone who has trouble breathing, unconscious, incapacitated, or otherwise unable to remove the mask. I mean, for any underlying health and safety reason. So we did change the language. So the first draft that I sent you guys had masks required outdoors for high risk sports. So I think the ones that really, we don't have any outdoor of these sports that I know of, except for maybe competitive cheer and football. So football is kind of what stands in my mind when I talk about these high risk outdoor sports. It originally had masks required. Northampton, when they did an amendment last Thursday, they took it out to have the language that we have now, which is on the sidelines, basically while not actively playing. I know Amy, our other Board of Health member, just so people are familiar, she did send me a response when I first sent out the draft that she wasn't sure there was a ton of evidence that the virus was transmitted outdoors. However, as you know, we're kind of dealing with a different monster at this point with the Delta variant. We know it's 2 times more transmissible. It's accounting for 98% of our cases. So that's kind of where Northampton started with the idea, but they ended up taking it down after hearing some public speak from the athletic director. So it's kind of up to you guys. I think right now we would be the only community that does it. So I know that was one of the athletic director's concerns, I believe, in the other towns, was that, when they go from town to town, there might be a disadvantage.
Oh, right.
I mean, my feeling on this is, CDC guidance, even outdoors right now, is if you can't maintain, social distance, if you can't avoid close contact, you should wear a mask, indoors or outdoors. I mean, I'm just imagining, football, like, helmet to helmet on the line over and over again. I mean, but that being said, like, we don't yet have the data. We know that the prior strains, the risk of transmission outside is extremely low, but we don't have enough data about Delta to know that for certain. So I guess I think it's not unreasonable to leave it this way for now. But, maybe we could add something that says, like, although it is highly recommended, it is not required, or something like that, just because, there is the risk of close contact in those situations.
Yes. And once we have the bones of an order, it's easier to amend it. So
maybe that's something we can look at the monthly review, like, school sports will be starting. We'll have more data, hopefully not a lot more, but.
I was going to ask, sorry, I didn't mean to interrupt.
No, that's okay.
I was going to ask, you had mentioned that MIAA had mandated masks for indoor sports. So I'm assuming they have nothing mandated for outdoor sports at this time.
I don't believe so.
Okay.
I mean, I would agree with the high risk sports for sure. And then I'm just looking at the mandate. So it's just on the sidelines for moderate, right? That's the way I'm looking at it.
Both high and moderate
Yeah.
was changed for.
Yep. Well, yeah, okay, I agree to, why don't we leave sports as is? And it's something we can review. And like you said, Bree, it's easier to make an amendment than, you know, to take something out in the future.
And we have a CTC doing our contact tracing for us right now in the interim.
Good.
So I can flag them to look out for, you know, specifically contact me for sports.
Yep, yep.
I agree with that.
Okay. So is there anything else we need to talk about, Beth, that you, anything flagged for you about any of the other contents of the?
No.
Sorry.
Now it's happening with me. Sorry. Sorry. No, there. I think I mentioned that the things I had thoughts on. I don't think I have any other input or anything else I think we need to discuss.
Bree?
I don't think so. If you guys voted in, I will send it to you via DocuSign tonight if you guys are able to sign it. And then I will I'm going to try to get some of it done tonight, get it up at least on the website, our Facebook, email to our restaurants, and then spend tomorrow kind of making sure it gets out to people. But if you're okay with the effective date of Thursday, so it just gives me a day to.
Yep. Do we have to make a motion for each change you're making, like the 6 feet and the?
I think you could just make a motion to approve the order with the edits requested.
Edits, okay.
And then I'll send you, I'll make the edits tonight. I'll send it to you. And then if you both agree, I'll get it to you in DocuSign, and then we'll get it out to the public and the website and such.
Okay. All right, so I'll make a motion to approve the City of Easthampton mandatory policies and procedures for wearing of masks or other face coverings in the City of Easthampton for COVID-19.
I second that motion.
All in favor? Maggie, yes.
Beth, yes.
All right. Mandate passed.
Well, thank you guys. I will, for our next Board of Health meeting, which was our regularly scheduled one for September 8th, we'll get back to our normal approving of minutes and our well discussion and the plastics ordinance. I invited Councilor Owen Zarrett to come speak to you. I don't think he had a chance to connect with Amy, so I think it'd be easier for him to just come and speak about the deferment process. And I'll send you the memo that we will send out to all of our restaurants and the deferment application, just so you can see the language. I know there were some concerns and I brought those up to Owen, so hopefully we can kind of work through those at our September
Does
meeting.
Beth have all the documents for the well stuff? Like the letter from the lawyer and all of it? Okay.
Yep, I got all that from before the last meeting that I just observed because I wasn't official yet, but yeah.
Okay. All right. All right. What time? Let's see. Somebody. Okay, 5:44. Make a motion to close the Board of Health meeting for August 31st, 2021.
I second that.
All in favor, Maggie, yes.
Beth, yes.
Meeting closed at 5:44 p.m.
Thank you. I will send the edits to you guys in 20 minutes or so.
And I thank you all for your comments and attendance. Thank you. All right. Have a good night, everybody.
See ya.
All right, you too.